Ready for another deep dive? We're tackling thyroid tumors today.
Oh, interesting.
Yeah, it's wild how often we sort of take our thyroids for granted, right?
It really is, yeah, until something's off.
Exactly, and from what I've seen, thyroid cancer, it's not like a one-size-fits-all kind of thing, which is a bit daunting, actually.
No, you're absolutely right, and I think that's what makes it so complex, right? There's actually a bunch of different types of thyroid cancer.
Right.
Each with their own, kind of quirks, their own challenges.
Okay, so you've already piqued my curiosity here. I got some documents you pulled together.
Right.
One of them seems to be focused on, like, a 69-year-old woman. She's got this suspicious nodule on her thyroid. And let me tell you, there are some seriously technical terms in here.
Medical jargon. Yeah, it's a real thing.
Yeah. Bethesda, PTC. This is like, it's like trying to decipher a secret code.
Well, and that's exactly what medical professionals do, They have their own shorthand.
Right.
And they rely on it to communicate clearly and efficiently.
Right.
But yeah, it can definitely sound like a foreign language if you're not familiar with all the lingo.
100%. So break it down for me. What's the deal with this Bethesda thing?
Okay, so the Bethesda system, that's basically a way to classify thyroid biopsies.
Okay.
And it helps determine, how likely is it that this is cancer.
Got it.
And PTC, that's short for papillary thyroid cancer.
Okay.
Which is actually the most common type.
The most common that we see.
Wow.
Yeah.
Okay, so it's like they're speaking in code to save time.
Exactly.
But luckily, we have you, the decoder ring.
I'll try my best.
Now, this document itself, is this like a patient's file or is it something else?
It looks to me more like a set of notes or
Okay.
observations, possibly from like a consult or an initial assessment. And you see that a lot in healthcare.
Yeah.
Especially when you've got multiple medical professionals involved.
I can only imagine. Just to kind of get everyone on the same page quickly. Exactly. A common language, a quick way to share the most important details. And, even though it's brief, this document, it's got a lot of juicy information.
Oh, I bet.
For example, just that phrase, suspicious nodule.
Right.
That's a huge red flag, right? It means we need to look further.
It's like finding a clue at a crime scene.
That's a great analogy.
Okay, put on our detective hats.
Exactly. Figure out what's really going on.
I love it. So we've got a potential medical mystery on our hands. Some cryptic medical jargon, what seems like a set of clues pointing toward, this possible thyroid issue.
Yeah, absolutely.
This is already shaping up to be quite the deep dive.
Oh, this is just the beginning. As we get deeper into these documents, we're going to unearth even more
Good.
details about the different types of thyroid cancer, how they behave, how we treat them.
All right, well, let's talk about these different types then, because I am already curious. What makes them so different from each other?
So it all comes down to the cells within the thyroid gland itself. Each type of thyroid cancer, it originates from a different cell type. And just like different cells have different jobs, these cancers behave differently too.
Oh, interesting. So it's not even just about, like, okay, you have thyroid cancer. It's like, what kind do you have? Because that changes the game completely.
Yeah, you wouldn't treat every plant the same way, right? You wouldn't give a cactus the same care as like a delicate orchid.
That's a good analogy.
Each thyroid cancer needs its own approach, its own, strategy.
Okay, got it. Now, we keep bumping into this papillary thyroid cancer in this document.
Right.
And you mentioned it's the most common type, especially in women. So what's the story there? Why is this one so prevalent?
Well, papillary thyroid cancer, it often gets called the good cancer, which sounds strange, I know. But it's because it tends to be really slow growing, and it often shows up in multiple spots on the thyroid.
Oh, wow.
We call that multifocal. Makes it trickier to treat. But the good news is, if you catch it early, the prognosis is usually pretty good.
Okay, that is reassuring, especially if they find it in those initial stages.
Exactly.
But then on the flip side, we've got anaplastic thyroid cancer, which sounds way more aggressive, just from what I'm seeing here.
Yeah, it definitely can be. And what's interesting?
What's that?
Anaplastic thyroid cancer, it often develops from pre-existing thyroid cancer.
Really?
That hasn't been addressed, hasn't been treated properly. Think of it like a garden, right?
Okay.
If you let a garden go wild, totally neglected, aggressive weeds, they take over.
Oh, wow. I see what you're saying.
That's kind of what anaplastic thyroid cancer is like.
So something that might have started as more manageable
Exactly.
can become a much bigger problem.
That's why regular checkups are so important. Early detection is key. What seems like a minor thyroid issue could become something way more serious if you just ignore it.
Wow. That's a powerful image. Makes you really stop and think. Now, we can't forget about the rarer types that are mentioned here, like follicular and medullary thyroid cancer. What sets those apart?
So follicular thyroid cancer, it's less common than papillary, but it can be more aggressive,
Okay.
especially certain variants like Hürthle cell carcinoma. This one tends to spread through the bloodstream rather than the lymphatic system.
Interesting. So different types, different ways of spreading.
Exactly.
Wow. What about medullary?
Medullary is interesting. It actually comes from the C cells in the thyroid. They're the ones that produce a hormone called calcitonin.
Yeah.
And this type, it can run in families sometimes, linked to certain genetic mutations.
So each one really does have its own personality, its own, like, quirks almost.
Like a family with all its different characters.
It really is. But at the end of the day, it seems like getting that precise diagnosis, like knowing exactly which type you've got,
It's crucial.
that's the key to figuring out how to treat it.
Absolutely. It's like having a map before you go on a trip, right? You need to know your starting point, your destination, to plan the best route.
100%. Speaking of journeys, this document, it outlines some potential treatment options, especially when it comes to surgery. And some of these terms are kind of intense. Total thyroidectomy, hemithyroidectomy. Break those down for me.
All right, so total thyroidectomy. That means removing the entire thyroid gland. Usually that's recommended for larger tumors, the ones that might have spread beyond the thyroid, or if there's a high risk of it coming back.
Makes sense.
Now, hemithyroidectomy, that's a bit less intense.
Okay.
That's just removing half of the thyroid gland. And that's usually an option for smaller tumors, the less aggressive ones that haven't spread.
Got it. So it's all about choosing the right tool for the job based on like the size, the type, all those factors.
Exactly.
Now, there's one other term here I've got to ask about because honestly, it sounds kind of scary. Lymph node dissection. What is that?
Okay, so think of your lymph nodes like little checkpoints throughout your body. They're always there filtering out harmful substances, but they can also be a way for cancer cells to spread.
So they're like, what, these little guards making sure nothing suspicious gets through?
Exactly. But sometimes those cancer cells, they can slip past the guards. And that's where the lymph node dissection comes in. It's basically a way to check those checkpoints, see if any cancer cells have made it through.
So it's like they're not just taking them out, they're really examining them.
Yeah, they remove some of the lymph nodes and then they look at them under a microscope, see if there are any cancer cells hiding out.
So it's all about understanding the bigger picture, right? Like, has it spread? And if so, how far?
Exactly. We're staging the cancer, figuring out how advanced it is.
Which then obviously informs what you do next.
100%, yeah.
Yeah.
It helps us make decisions about treatment, what the next steps should be.
Okay, got it. So let's bring it back to our case here. This 69-year-old woman, we know she's got this suspicious nodule. Based on everything we've talked about, the types of cancer, the surgery, the lymph nodes, what do you think her path forward looks like?
Well, every patient's different, obviously, right? Treatment's not one size fits all. But we can use what we know to make some educated guesses.
Right.
Given her age. And the fact that papillary thyroid cancer is pretty common, especially in women. Her doctor's probably going to want to do a repeat ultrasound, get a better look at her lymph nodes, make sure there's nothing funky going on there.
Like a follow-up investigation, just to be extra sure.
Exactly. And chances are they're going to want to do a biopsy.
Okay.
Most likely a fine needle aspiration. It's a pretty simple procedure. They just use a thin needle to take out a few cells from the nodule.
So not a huge ordeal for her, hopefully.
No, nothing too intense. And that'll help confirm the diagnosis. Yeah.
Right, because we've got to know what type of cancer it is.
Exactly. Once they have those biopsy results, then they can really start making decisions about surgery, if it's needed, what type, all of that.
Got it. So it's like each step gives you more information to make the best possible decision.
Exactly. Biopsy, imaging, the patient's overall health, it all plays a role.
Wow. It's kind of incredible, really, how one suspicious nodule can lead to this whole cascade of events.
Oh, absolutely. It's complex, for sure.
Well, I have to say, this deep dive has been incredibly eye-opening. We've gone from medical jargon to surgical options and everything in between.
We even explored those crucial lymph nodes. Don't forget about those little checkpoints.
Oh, could I? They're our first line of defense, it seems like. But all of this has got me thinking, you mentioned radioactive iodine therapy before. What is that all about? How does that even work?
That's a fascinating one. It's basically using radioactive iodine to target and destroy any thyroid cancer cells that might be hanging around after surgery.
Oh, wow. So it's like this super precise way to make sure they got everything.
Exactly. Like a targeted missile going in and cleaning up any stragglers.
Wow. See, this is why I love these deep dives. There's always more to learn.
It's a never-ending journey, isn't it?
It really is. But for today, we're going to have to leave it there. We've covered a ton about thyroid cancer, the types, the diagnoses, the treatments. But like we always say, this is just the tip of the iceberg.
Absolutely. There's a whole world of information out there for anyone who wants to dive deeper.
And we encourage you to do just that. Be your own advocate, ask questions, do your research, and until next time, keep those brains engaged, and we'll catch you on our next deep dive.